Kyle Moyer. COVID-19 is responsible for the deaths of over 1 million people in the United States alone. According to the COVID data tracker from the CDC website, last updated on October 28th of 2022. Everyone in this room has wanted to be done with the pandemic at some point over the last 3 years. The United States has implemented measures to prevent the spread of COVID-19 to put an end to the pandemic. First, we will discuss the effects that vaccines have had on the pandemic. Second, we will discuss the effects that masks have had on the pandemic. And third, finally, we will discuss the effects that shutdowns have had on the pandemic. The rollout of vaccines have prevented people from being hospitalized and dying. According to Lucy McNamara, who has a PhD in microbiology and immunology, in the journal The Lancet, published in November of 2021, the fewer number of COVID cases can be directly linked to the vaccine. Ever since the vaccine was made, there have been a decrease in the number of emergency department visits. And ever since people started to get the shot, there's also been a fewer number of deaths. The vaccine was first made available in December of 2020, prioritizing high-risk groups of people. From there, vaccine availability expanded to people at lower risks. Now that we have discussed the effect that vaccines have had on the pandemic, let's discuss the effects that masks have had. The implementation of masks has had a massive effect on the pandemic. Viktor Chernozikov, a statistician and economist at MIT, in the Journal of Econometrics, published in July of 2020, says that face coverings reduce the transmissibility of infected droplets in labs and clinical trials. If masks were worn by everybody, whether they are sick or not, it can prevent people with COVID who are symptomatic or asymptomatic from spreading the virus to others. Since some transmissions take place before symptoms are present, this shows that everyone, whether they feel sick or not, should have been wearing masks. And although masks did help, if they were implemented earlier into the pandemic, an estimated 19,000 to 47,000 more lives could have been saved. Jiao Wang, a researcher with the Chinese CDC, Key Laboratory of Environment and Population Health, in the article Environmental Pollution, which was published in 2020, says that masks are the optimal choice to reduce the number of transmissions. Now that we have discussed the effects that masks have had on the pandemic, let's now discuss the effect that shutdowns have had on the pandemic. Business shutdowns, as well as stay-at-home orders, have reduced COVID transmissions. If business shutdowns were never put into place, up to 80% more cases could have appeared. And if stay-at-home orders weren't put into place, there could have been up to 60% more cases. Although school closures couldn't be directly tested, it can be assumed that they reduced COVID transmissions since students weren't in close contact with each other for as long. Since the government implemented business shutdowns and stay-at-home orders, many lives have been saved. First, we discussed the effect that vaccines have had on the pandemic. Second, we discussed the effect that masks had on the pandemic. And third, finally, we discussed the effect that shutdowns have had on the pandemic. The United States has implemented measures to prevent the spread of COVID-19 to put an end to the pandemic. Over 1 million people have died from COVID, and if the government hadn't implemented these measures, there could have been many more deaths.
466